Well, hey everybody, this is Robert and welcome to today's newscast. Today we're going to be looking at a rare Crimean-Congo hemorrhagic fever case and death in the country of Greece. In Greece, the National Public Health Organization reported that a domestic case of Crimean-Congo hemorrhagic fever, or CCHF, was recently recorded in a settlement in the municipality of Elisona, Larissa Regional Unit, Thessaly region. This is a patient over 70 years old who was hospitalized with severely deteriorating clinical picture and eventually did die. Now, the disease manifests with various symptoms and severity, from asymptomatic infection in about 85% of cases, or mild febrile illness, to very severe disease. Now, symptoms appear 1 to 14 days after exposure and may include sudden onset of symptoms such as fever, chills, headache, myalgia, arthralgia, fatigue, dizziness, sore throat, abdominal pain, diarrhea, nausea, and vomiting. Mood and level of consciousness disorders may follow. In severe cases, hemorrhagic manifestations, multi-organ failure, and circulatory shock can occur. The disease has a high mortality rate, about 30 to 50% in hospitalized patients, and there is no specific treatment. Now, Crimean-Congo hemorrhagic fever is a tick-borne viral hemorrhagic fever, widespread worldwide, with approximately 10 to 15,000 infections recorded per year. Now, sporadic cases and epidemics of the disease have been recorded in more than 30 countries in Asia, the Middle East, Africa, and Europe. Now, in Europe and neighboring countries, cases have been recorded in the Balkans. This includes Bulgaria, Albania, Kosovo, and North Macedonia. And also in Spain, we've seen a case earlier this year in Spain, Portugal, Georgia, Russia, Ukraine, and Turkey. Now in Greece, there was another domestic case of the disease, which was recorded back in 2008. High-risk groups include people who have activities in areas where ticks are present. For example, in the countryside, in rural and mountainous areas, as well as those who come into contact with blood or bodily fluids of animals, such as livestock breeders, shepherds, farmers, hunters, loggers, gardeners, slaughterhouse workers, those who go camping, nature lovers, climbers, hikers, and healthcare professionals who may come in contact with a patient. Now, due to the recent recording of this case of the disease, the National Public Health Organization recommends taking personal protection measures against ticks as a priority for high-risk groups and in the wider area of exposure of the patient. It is noted, of course, that most ticks are not infected, and the risk of someone getting sick after a tick bite in the country is considered low. However, because the diseases that ticks can transmit, if infected, can be serious, such as in the case of CCHF, precautions should be taken. Now, health authorities specifically recommend the following precautions. Avoid areas where ticks may be present, for example, in forests, meadows, areas with trees, bushes, tall grass, piles of leaves, and dense vegetation. In case it is necessary to be in areas where ticks are likely to be present, they recommend always walk in the center of the paths and not in dense vegetation. Wear light-colored clothing so that ticks can be easily seen, and preferably long-sleeve shirts, long pants, high socks, and boots or closed shoes. Tuck your pants into your socks and boots. Wear gloves, especially when touching grass or plants or animals with your hands. Tuck your shirt sleeves into your gloves. Apply insect repellent sprays or lotions to bare, exposed skin and over your clothing, according to the manufacturer's instructions. Do not lie down or sit directly on the ground outdoors. Take a shower or a bath immediately after returning from the outdoors. Carefully examine your clothes and skin for ticks during and after outdoor activity. After returning home, take your clothes, socks, and shoes outside the house and check them for ticks. Now, if you spot a tick on your clothing, remove it carefully, but not with your bare hands. If you find a tick on your body, it should be removed as quickly and properly as possible with appropriate tweezers. If you do not know the correct way to remove a tick or do not have the appropriate tweezers, do not remove the tick yourself, but go immediately to a doctor, the nearest hospital. Do not pick up the tick with bare hands, but always wear gloves. Do not crush, do not break, do not squeeze, or do not pierce the tick's body. Do not disturb the tick when it is attached to the skin. For example, don't pour alcohol or oil or Vaseline or petroleum jelly on the tick. Apply preventive treatment against ticks to your animals at regular intervals, always according to the veterinarian's instruction, and carry out regular disinfections in stables and livestock units. Wear gloves and protective clothing when coming into contact with animals with blood or other animal tissues and secretions, for example, when slaughtering animals. The standard advice is to drink only pasteurized milk and not eat fresh, soft cheeses unless they have been matured for the required period of time. Also, do not consume dairy products unless you know that the correct manufacturing process has been followed to protect you from various diseases transmitted in this way. Now, to reduce the risk of human-to-human transmission, avoid close physical contact with suspected or confirmed cases of hemorrhagic fever. Wear gloves and protective equipment when caring for patients. Wash your hands regularly after caring for patients. And for healthcare professionals, strictly implement basic infection prevention and control precautions when examining, caring for, and treating patients. Now, national and regional public health and veterinary authorities are in constant communication and cooperation to coordinate prevention and response actions. The Ministry of Health, the National Public Health Organization, and the Ministry of Rural Development and Food are coordinating the response actions in collaboration with the regional local authorities. Now, on June 27th, a working meeting of the National Public Health and Veterinary Authorities, the regional local government, public health and veterinary authorities, and specialist scientists was held for the organization and coordination of prevention and response actions. Now, the meeting was attended by the Ministry of Health, the Hellenic National Organization for Public Health, the Ministry of Rural Development and Food, the National Reference Center for Arboviral and Hemorrhagic Fevers, the competent services of the University General Hospital of Larissa, the Regional Governor of Thessaly, the General Directorate of Public Health and Social Welfare, and the Directorate of Veterinary Medicine of the region of Thessaly, as well as specialist scientists from Elgo Demetra organization and the Agricultural University of Athens. The immediate response actions decided upon included immediate investigation of the patient's contacts in the family and hospital environment, for example, in the healthcare settings, risk assessment of contacts and contact tracing, informing actions for health professionals to be vigilant regarding suspicious incidents at local and the national level, actions to inform high-risk groups at local level about the recommended preventive measures, the sampling of ticks in animals from the specific area for the presence of the virus. Targeted disinfections in the specific area. Sero-epidemiological study on samples of the population of the specific area, and targeted disease control and prevention measures in animals by veterinary authorities. Health officials recommend the implementation of the measures meticulously, especially for the high-risk groups. So again, we have a rare case of the hemorrhagic fever, Crimean-Congo hemorrhagic fever, in the country of Greece. And the case turned out to be fatal. And that's the latest newscast from Outbreak News Today. Thank you very much.